Chinese side of the China WHO Joint Mission for the Global Study of Origins of SARS-CoV-2, Liang Wannian, Director of Wuhan National Biosafety Laboratory, CAS and Research Fellow of Wuhan Institute of Virology, Yuan Zhiming. They will give you a briefing on related work and answer questions of this topic. Now I'll give the floor to Mr. Zeng Yixin. Friends from the media, good morning. I'm glad to see so many friends from media organizations to this press briefing on the work on the origins of COVID-19. This is quite a specific topic. Since the start of COVID-19, each and every responsible country and each and every scientist with social responsibility very much hopes to get to the bottom of where the virus came from. This is of great significance for preventing the recurrence of similar diseases. On March 30th this year, WHO officially released the WHO-convened Global Study of Origins of SARS-CoV-2 China Part Joint Report. This has set an excellent beginning for the research of global study of origins. Government, scientists, and media across the world pay high attention to this report. Over the past months, more and more scientific evidence show that this is a highly valuable, authoritative report that stands the test of time and history. The conclusions of the report are scientific, and the process of drawing these conclusions uphold the rules of science. Now, I would like to walk you through the working process of the report. Before we conducted the joint study with WHO, the COVID response task in China was actually very heavy. Nevertheless, we organized multidisciplinary teams on work related to origin sourcing. And it was on the basis of such work that our experts, together with WHO expert of its advanced team in July last year, worked out the terms of reference TOR, and China strictly followed the TOR on work related to origin study. At the beginning of this year, the WHO International Expert Team came to China to officially start work on global study of origins China Part. In the principle of openness, transparency, science, and cooperation, China fully supports the work of WHO experts together with local governments. We made every effort to organize and coordinate relevant departments to fully meet the requirements for visits by WHO experts. They were able to visit all the departments they wanted to go, including Jingtan Hospital, Huanan Seafood Market, Wuhan Institute of Virology, altogether 9 institutes, and met all the people they wanted to meet, including medical workers, lab workers, researchers, market management personnel, shopkeepers, and community workers, and recovered patients. The origin study involved a lot of work. WHO experts worked very hard. They studied seriously every matter and work day and night, no time for food or sleep. Their professionalism and spirit of science is admirable. Here, on behalf of the Chinese government, I would like to pay high tribute to the experts of the WHO International Expert Group. Now, the second thing I want to talk about is the main conclusions of the joint study. The report we're talking about is a report on global origin study of China Part. The expert group concluded that in bats and pangolin, the coronavirus is mostly highly related to SARS-CoV-2, with the highest homology. Yet, they are not enough to prove that they are the direct ancestor of SARS-CoV-2. Though there is a high homology, there is still some difference. And other animals might also be potential hosts. And in light of epidemiology, animal environment tests, and research results of various aspects, the joint expert group identified the possibilities of pathways. First, direct spillover from animals to humans, possible to likely. That is zoonotic spillover. Direct spillover, possible to likely. And spillover from animals to humans through an intermediate host, likely to very likely. That is from natural hosts, animals, through an intermediate host to humans. It was likely to very likely. That's the second possibility. And the third possibility is introduction through refrigerated or frozen foods. Last year, in the sporadic cases in different parts of China, we found out that it was possible that the virus was introduced through refrigerated or frozen foods. It was possible. And the last possibility is laboratory leak. It is extremely unlikely. The third point I want to make is work on origin studies for the next phase. For one thing, on the China Part report, where things need to be improved, we are actively supporting relevant department scientists to continue their work and to give feedback to WHO experts in a timely manner. And the China Part report has identified a direct direction for next phase origin study in multiple places, multiple countries under the global framework. We need to follow that direction and take forward. Let me also say that the WHO-convened global study of origin is an excellent international joint cooperation. And together with WHO, we have identified an effective working mechanism and method to cope with emerging infectious diseases. WHO experts and Chinese experts have established sound cooperation mechanism, and they worked excellent together. Such excellent collaboration is of great significance for advancing related work. Moreover, the experts uphold professional attitude, scientific and rigorous. They repeatedly studied and analyzed specialized matters. We do hope that the international experts participated in the China Part study will continue to play their role and to employ their valuable experience to the global study going forward and to contribute to get to the bottom of the source of the virus. Study on the origins of the virus is a complex scientific matter. It is a complex matter for the world, like HIV/AIDS, Ebola, MERS, SARS in 2003, avian influenza in 2009. The origin tracing for these viruses all have been proved very difficult. For some of them, the answer is yet to be found. Therefore, for the next phase, it is important that work will be conducted with the coordination of WHO, and on the basis of the first phase study, excellent experts of multiple countries need to be organized. Scientists must be the main actors in the studies, and we call for greater exchange and cooperation, information sharing, and conduct such work on the scientific track. That's all for my opening remarks. Thank you. Thank you, Mr. Zeng Yixin. Now I will open the floor for questions. Please identify yourselves before you raise questions. Now the floor is open.
先这边吧，第一位举手的这位记者，第二排的正中间这个。我是总台央视新闻频道的记者。
From
正如
CCTV.
刚才讲到的说。这个病毒溯源其实是一个长期而复杂的
Well, the study of origins is a long-term and scientific matter. In 1918 and 2009, and with HIV and AIDS, the study of origins of different viruses were conducted, and this time around, the virus study was conducted in China. What was the meaning of such study? Well, let me answer your question. This is a very important and necessary health and scientific matter. For infectious diseases, there are three important matters. First is the source, second is the pathway, and the third is the infected. And these three factors compose the most important things in infectious diseases. And scientific origin source is related to all these three factors. It can answer the question where the virus came from. It is of great significance for the current round of infectious disease, and it is also of great significance for possible future emerging infectious diseases. That's why the whole world is paying a lot of attention, and Chinese scientists also pay high attention to this matter. This matter deserves our serious study. Again, as Mr. Zeng Yixin said, since it is highly complex, we must approach it with a scientific spirit. Next question, please.
第三排这位男记者。
Thank you. With Asahi News, I have two questions. First, last week the WHO proposed a second phase origin tracing on China, including studies on the Wuhan seafood market, as well as auditing for research institutes like the Wuhan Institute of Virology. And they demanded higher transparency. How do you comment on that? Will you accept another investigation on the origins? Second, in March, WHO published the report, the China part report, claiming that it is extremely unlikely for the leak of the virus from the institute. But some scientists also considered that we need to look at the two possibilities of natural birth of the virus as well as lab leak. So, regarding whether the virus was man-made or naturally born, what is China's comment?
Let me answer your first question. Thank you for your question. On July 15th, WHO announced the plan for origin studies for the next phase. Well, to be frank, I was taken aback when I learned about this. Why? Because in the plan, It set as a priority the hypothesis of China violated the lab protocols. This reflects irrespect for common sense and arrogance against science. First, on the rumors on Wuhan Institute of Virology, including 3 workers get infected, and the gain of function of the institute. These have been proved rumors. And the bat samples and the coronavirus tested in the bat samples, RTG13, have 96.2% of homology. Such homology is impossible to get directly infected to humans. And another hypothesis is man-made virus. There was Indian researcher who found that part of the sequence share homology with HIV/AIDS, and he wrote a paper on the possibilities of man-made virus. And in the pre-printing stage, the paper was refuted by fellow scientists in other countries, and the paper didn't get to be published. And many scientists conducted in-depth analysis, and their conclusion is that the genome sequence has no trace of man-made engineering, because otherwise it will leave traces in the genome sequence. No worker or researcher in the Wuhan Institute of Virology got infected by coronavirus. No gain of function study was conducted in the institute. No study of man-made virus was conducted. And where did this laboratory leak come from? Such a notion defies common sense and science. WHO experts visited the Wuhan Institute of Virology, and their conclusion is that the laboratory leak possibilities extremely unlikely. These experts are highly authoritative and professional experts selected by WHO. We respect their conclusions. About the plan on the second phase of origin study, it contains language that does not respect science or common sense. We won't follow such a plan. Origin study is a science matter. The Chinese government supports origin study based on science. Yet we oppose politicizing the origin study. We believe that the second phase should be conducted on the basis of the first phase and follow the WHA 73.1 resolution and proceed with full deliberations and consultations on the researches that have already been conducted, especially those with clear conclusions. There's no need for repetitive work in the next stage. We hope that with full consultation with member states, early stage case search should be conducted multi-places in multi-countries globally, and origin studies in molecular epidemiology and animal intermediate hosts. What has been done in China shows that scientific and reasonable work methods is crucial for carrying out international cooperation. It reflects the respect for sovereign countries with full consultation and consensus, and it will also help with orderly and smooth advancement of related work. What's important is to draw on the successful stories of the first phase, and on this basis, carry out work going forward. On this basis, on July the 4th, China proposes China's proposals to WHO experts on the work of second phase on WHO-convened global study. And we put forth our key rationale and viewpoints. We hope that WHO will take them into serious consideration and truly approach origin studies as a science matter to stay free from political interference and to facilitate steady origin study in multiple places, multiple countries across the world, to step up scientific research cooperation among different countries and do our utmost to prevent recurrence of similar viruses of animals or humans. What's the purpose of the origin study? It's to get to the bottom of the source of the virus, to learn more about the virus, to prevent the potential recurrence of any similar disease. We need to uphold that principle and follow science spirit. That is what China has been doing.
Well, regarding the rumors for the leak from the institute, the Wuhan Institute has made a lot of elaborations, and just now Minister Zeng made some remarks, and let me add a few words. It has been a general consensus by the academic community that the coronavirus was naturally generated. And the experts issued another statement saying that no evidence can support the theory of laboratory leak from China. On the 7th of July, 21 scientists from the United States, United Kingdom, Australia, and other countries published an article stating that there is no evidence that the SARS-CoV-2 originated in the laboratory. There's no evidence that there's any connection between any early cases of the coronavirus and the Wuhan Institute of Virology, and there's no evidence that before the pandemic, the Wuhan Institute owned or was studying the progenitors of the SARS-CoV-2. Just a couple of days ago, 22 Chinese and foreign scientists jointly published a paper using the classical evolutionary theory methods to convincingly demonstrate that the SARS-CoV-2 can only be derived from nature instead of being manufactured by human. I also have noticed that some media outlets are watching closely the safety of Wuhan P4 laboratory. As a laboratory with the highest level of biosafety protection, Wuhan P4 laboratory, since its operation in 2018, has not had any pathogen leakage or personal infection accidents. It was designed and constructed as well as operated in accordance with international requirements and national standards. It has stable and reliable biosafety protection devices as well as a complete management system and a team of professional maintenance, management, and support. I can say this for sure, that Wuhan P4 Laboratory has a high level of management, staffing, and working methods, just on the same par with other international P4 laboratories. There have also been reports saying that 3 research fellows from the Wuhan Institute of Virology visited the hospital in November 2019, and their symptoms were the same with COVID-19. This is completely out of nothing. If you want to clarify the facts, just provide the names of the 3 people. Then the truth will be revealed. Actually, we made this suggestion very early, but so far, we have not received any response. Let me stress that first, before the 13th of December 2019, the Wuhan Institute has not been exposed to, preserved, or studied the SARS-CoV-2. Second, the Wuhan Institute has never designed, manufactured, or leaked SARS-CoV-2. And third, so far, the staff and students of the Wuhan Institute have maintained a record of 0 infection of COVID-19. In face of COVID-19 outbreak, the Wuhan Institute has been leveraging its long-established platform, know-how, and talents to determine the SARS-CoV-2, isolate the virus strain, determine the whole genome sequence, and provided that to the WHO on the 12th of January 2020. These important outcomes have laid the foundation for the global pathogen detection, antiviral drug screening, and vaccine research. And after the isolation of the virus strain, we have organized efforts on the screening of antiviral drug and the vaccine research, provided effective support for science-based response. But also, due to its location in Wuhan, the Institute has been attracting global attention. It has been also subjected to all sorts of rumors. Such rumors have exerted huge pressure on the research fellows in the Institute and have also interfered in the normal work of the Institute. They have also produced negative impacts on the normal exchanges and cooperation internationally of the Institute. Facing with the still raging coronavirus, no country can stay unaffected. Only with international cooperation and coordination can we effectively contain the spread of the virus, and can we help people in the whole world regain normalcy. The Wuhan Institute of Virology will continue to adhere to an open and transparent attitude and do our part in the international fight against COVID-19. Well, let me also add a few words. In January and February this year, the WTO China Joint Mission during the work of origin tracing put forward the 4 potential channels of introduction, and one of those hypotheses was laboratory leak. When we were thinking about those hypotheses, we combined our previous experience, particularly our knowledge on coronaviruses, including introduction from nature, introduction from wild animals, including through an intermediary host, or long-distance transmission through refrigerated or frozen foods, or a laboratory leak. And how can we arrive at our conclusion? Actually, we're focused on the material collection regarding the 4 hypotheses, including literature, data, and field trips. On the laboratory leak hypothesis, when the experts were discussing that argument, As Minister Zeng and Mr. Yuan mentioned, it can only have two options. First, a artificial synthesis, or second, a leak from the laboratory. And that depends on whether the institute has the virus or not. And the conclusion is very certain. The institute has never done such a study, and it does not have the virus. But to further verify this hypothesis, the experts visited the institute and learned about relevant information in a very thorough manner and talked to the research fellows and the management teams and held field trips, particularly on the protocols of its operation and on its management and safety mechanisms, including the research projects of the institute, previous projects, ongoing projects, etc. And after that, we discussed the matter in two perspectives. First, what evidences can support this hypothesis? And second, what are the evidence that do not support this hypothesis? On the 30th of March, in the report issued by the WHO, it has very detailed description, including our visit to the institute and very thorough records of that visit. And our final conclusion is that it was extremely unlikely for the laboratory leak. So there are 5 levels of possibility for the hypothesis. It is not 0 or 1. So for those 4 hypotheses, we had a semi-quantitative assessment from possible to likely to very likely and also down to extremely unlikely. And we think that the laboratory leak theory can be put into the bracket of extremely unlikely after discussion by the experts. And when we were drafting the joint report for the other introduction channels, from natural reservoir to human and natural reservoir to intermediary host to human, we had very clear conclusions and suggestions and future priorities and methodologies. But for the laboratory leak, we believed it was extremely unlikely, so that there is no necessity for us to invest more efforts or resources on this hypothesis. But we do not rule out the possibility that there could be some new evidence emerging that would call for further research. If some countries wish to do further studies on that, we Chinese experts would advise that relevant studies can be conducted in countries that have similar laboratories like the Wuhan Institute, and for the Wuhan Institute of Virology in particular, the experts have already done very thorough facts-finding and have come to their final conclusion. Thank you. Next question.
好，这边吧，第3排这位女记者。
Thank you. With Phoenix TV, previous reports that in 2012, the miners in the mines in part of Yunnan province were sick. And does that disease relate to the RTG13 of bat virus? Well, let me answer your question.
In October 2012, the Wuhan Institute of Virology received some information from Yunnan's hospital involving the serum samples of 4 miners in Yunnan province. After several times of nucleic acid testing and genetic sequencing, we did not detect coronavirus of bats in the samples. And that means that the virus has nothing to do with SARS-CoV-2. Regarding RATG13, it was detected, the genome sequencing detected from the serum in Yunnan instead of the serum samples that we received from the Yunnan miners in 2012. So no evidence show that these serum samples of the miners have anything to do with SARS-CoV-2. However, regarding the difference between RATG13 and SARS-CoV-2, the Wuhan Institute has made a lot of public announcements. In July 2020, Professor Shi talked about a 20 to 50 year time of evolution from RATG13 and SARS-CoV-2. And if you're interested, you can go find more information on that research. Next question.
谢谢卢作社提问。我有3个问题。最近
With Reuters, I have 3 questions. Recently, the WHO expressed concerns on information transparency. Is China willing to provide the raw data for the early transmission of the coronavirus? If not, what is the reason? Second, the Wuhan Institute of Virology manages a data bank for the virus. It was put offline in 2019. So the question is, has the Institute made public all the genetic sequencing that it has collected? And last question, in the joint report, the scientists have conducted testing for thousands of animal samples. Will China make more testings? Will studies be conducted for facilities and venues of animal reproduction? Will there be more bat species groups be researched? Thank you. Well, I'll take your first and third question. Regarding some early raw material and data, I think in January and February, during the joint submission, we conducted very thorough communication on that. It was a WHO-convened international team consisting of 17 international experts and 17 Chinese ones. It was a highly integrated team for the research. So we have 4 principles for that origin tracing. That was common drafting of the plan, common field trips, common analysis, and common display of the research reports. So those are the principles that we followed. For the origin tracing studies, the most important thing is early data. Just now, Minister Zeng mentioned, after the outbreak, Chinese scientists, before the WHO-convened studies, have already been led by the National Health Commission and the Ministry of Science and Technology to carry out large-scale origin tracing work. what we cared about the most was on animals and on early cases. For the data of early patients, some people have been saying that we failed to provide the raw data for the 174 early patients. As a matter of fact, we displayed all the cases of the early patients. But according to Chinese regulations, the clinical data and epidemiological data and the laboratory testing data, they all concern privacy. If we made them public altogether, it would not be in line with relevant regulations. So we Chinese experts worked with foreign experts on the data available and tried to find the patterns from the cases. And we worked on the conclusions together. But to protect the privacy of the patients, we did not agree to provide the raw data and did not allow the data to be copied. And this practice was fully understood by the foreign experts. And this is also an international practice, not just China. So later, we also made a lot of explanations regarding not providing raw data. It was a too generalized idea. We provided them for reference. We believe that is also a provision of the data, only that we did not allow the data to be copied. Second, what can be defined as raw data? Do we need to provide all the original data at every turn? Or can we put the data in order and then display the data? I think the international experts did not have any problem with the data provided by the Chinese side for joint research. So this is what I hope to add. So we did not intentionally decline to provide the raw data. And you cannot say that the report was biased because of what happened on the raw materials. Your third question on researches on animals. We believe in terms of animal-to-human introduction, particularly via an intermediary host, it is very likely. So we would suggest that in the future, more efforts can be put into this area, and this can be made a top priority. Chinese scientists have done a lot of work in this regard. I recall that when we were visiting Wuhan, the Chinese side displayed the testing results for animals in the market. As Minister Zeng mentioned, there was no positive testing results. And also for upstream reproduction farms, there was no positive results. And then we expanded the testing all the way to 2018 to 2020. All the 38,000 samples all over the country and over 41,000 samples for wild animals. In terms of nucleic acid and antibody testing, there was no positive results detected. So the category, the scope, and the testing methodologies were all laid out in the joint report. Whether in the market or in the upstream farms or in the wider regions of the country, whether domesticated lives or wildlife, Chinese scientists have made a lot of testing in terms of pathogen and antibody. There was no positive testing results detected. On bats, Chinese scientists have collected a lot of samples and made a lot of research. In terms of the breadth and width of bat research, I think China is doing better than most countries. We have done a lot of research on bats. As Minister Zeng and Mr. Yuan mentioned, we may have found similar viruses, but they are still different from SARS-CoV-2. So scientifically speaking, in the large number of bat samples, we have not managed to isolate SARS-CoV-2 from bat viruses. There are many types of bats, and they exist extensively in the world. In many regions in the world, there has been no systematic research on bats. So if the origin tracing studies are to be continued, I think the Part 1 outcomes indicate that bats should be made a priority globally, and it is highly likely that it can be an animal host for the virus. So we should not confine the research only to China, but we need to go further and expand the scope of researches anywhere that are home to a large number of bats can be made the future destinations for the origin tracing studies. So I think on animal origin tracing, it should continue to be a priority direction and field, and it is the most valuable field for our research efforts. And this is the area that we need to pay the most attention to. Not only bats, but also pangolin, ferrets, minks, and other animals. They should all be made research targets that carry or might carry pathogens. We need to trace the origin of those pathogens, and it will produce valuable outcomes. And also for markets and farms and upstream and lower stream institutions, I think relevant researches can also be conducted. So after the conclusion of the joint mission in China, we have been making a lot of efforts in this field, and we do hope that scientists all over the world can do this together with a focus on the evolution in terms of animals.
About the database the journalists talk about, it was actually a primary framework established by the Institute. The database has been improving and taking into consideration the management of website and the personal and work website email address has been attacked viciously for the safety, cyber safety and security. the database is shared within the institution.
Well, after the team has been taking stock of the raw data, it will be published as in papers for display and for searching. As we know that raw material need to be analyzed and sorted and be published in papers, and this is only a common practice in the scientific community. And the Wuhan Institute will continue to display and share the data following the rules of the scientific community. We always maintain that research information should be publicly shared, and after gaining the pathogen outcomes, we provided relevant information to the WHO. In February 2020, Professor Shi and the team published a paper on on Nature, proposing that the coronavirus can originate from nature. And after we have discovered that several drugs have antiviral activity to the virus, we shared our research outcome in international journals in February 2020, and we have also worked with the WHO, the American Academy of Sciences, and the French National Health and Medical Research Institution, etc., to convey video teleconferencing to share with them our outcome in terms of SARS-CoV-2 animal model, antiviral drug screening, and inactivated vaccine research. The laboratory always adhere to the principle of openness, sharing, and transparency. In the past 4 years, we have held a series of symposiums on biosafety, laboratory management, and technology management. We have also been taking an active part in regional and international cooperation on biosafety laboratories. We have been designated the UNSGM laboratory and a member of the GHOLD to share our experience and advancement with our international peers. Our staff have also been trained in countries like France, the US, and Canada, and we have invited experts from France, the US, Canada, the UK, and Germany to share experience so that we can work together for the safe, stable, and efficient operation of biosafety laboratories throughout the world. Thank you. Next question.
Thank you. Bloomberg News. Can I ask, since the WHO team concluded its field mission in China, research published in June showed that animals could have carried the coronavirus were being sold live at markets in Wuhan, including at the Huanan market. Was this known when the WHO team visited Wuhan? If not, why? And what investigation of these animals has taken place? Additionally, what communication has there been between China and the WHO about these animals? Second question, what progress has been made in checking for SARS-CoV-2 antibodies in the stored blood of Hubei residents collected in 2019? Thank you.
请翻译一下。
彭博新闻社一共有2个问题。首先，在世卫国际专家组的专家在武汉开展的实地考察之后，在6月份，我们得知，有可能会携带新冠病毒的动物在华南市场，有出售的这个信息。那么当时在国际卫生专家组去武汉调查的时候，中方是否知道这样的情况？如果知道，为什么不让专家组的专家去华南的市场进行实地的考察？ 在中方和世卫组织之间关于这些动物的情况有保持着怎样的沟通？第二个问题是关于和湖北居民他们的有关新冠疫情血液样本是否后续进行了进一步的检测？
好了，我来回答你这2个问题。第一个问题
Let me take your 2 questions. First, on
当时在1、2月
what you said.
联合专家组工作的时候，
In January and February, when the team was working in Wuhan, we were not aware of that information, and I can let you know that the joint team spent half a day in the Huanan seafood market for a field trip,
有关的商户
and we communicated with the sellers and the management team of the market to learn in details about the information of the market, including the stalls, the plan of the market,
管理的情况，
the management of the market,
监管的一些规定。
as well as the supervision
那么那个时候我们
or regulation of the
华南
market.
海鲜市场，因为当时已经关闭了，
The market was already closed by
没有营业
then,
的状态，
so it was not in operation.
花了好几个小时。
We spent hours in the market to be followed
华
by
南海鲜市场，
discussion.
无论从销售人员
So,
到我们
in terms of
的
both
结构和状况，
the
到销售
sellers and the buyers and the products that were sold in the market,
都是全部是展示
all the available information
共同的研究
was provided to the experts for discussion.
去了，并不是
So
没有去
we
华南海鲜
did
市场
go to the
那
market.
么其实联合专家组2月10号，国外的专家
On the 10th of February,
专家
the foreign experts left
保持着良好的
China,
沟通和联系，
and after that,
因为结
we
束
Chinese
现场
experts
工作
have
后面有大量
kept
的
in close contact
科
with
学的
them
问题
because there are a lot of scientific issues
所以大家可能
that
也注意
needed
到
to
2
be
月9号
discussed.
我们联合专家组
You may have noticed that on the 9th of February, we held a press conference in Wuhan,
就报告了
and the
说
final
3月
report was released on the 30th of March by the WHO
那么其实
officially.
这个事件，我们几乎是每天
And during this period, we kept
在一
in communication with the 17 foreign experts on a daily basis to refine the drafting of the report
讨论。
and to discuss on the accurate phrasing of
我
the
们世界上
report.
现在一直是保持
And after the report was released, we have continued to maintain in good
一
communication
些后续的工作
on
对一些科学
the
的
road,
问题
on the work ahead, and on some scientific issues. Chinese and foreign experts are talking to each other very closely. Just now, Minister Zeng mentioned that on
要做
the WHO's proposal of a second phase origin tracing studies, the Chinese experts also studied that proposal. According to our experience and feeling on the phase 1 studies, particularly on the basis of the report of the phase 1 studies, in a responsible manner, the Chinese experts
世卫组织
drafted
第2阶段溯源的一个建议，
its suggestion on the WHO-convened second phase origin tracing
相
studies.
关专家都进行了一些讨论，
And we
做了一些
discussed thoroughly with
交流，
foreign
也
experts
希望呢他们
for that
他们
suggestion.
的角度
We
也能给世卫
also hope that the foreign experts can make their suggestions to the WHO
提供依据。
in their perspectives.
保持良好的
So
关系。
we have been keeping in
其
very
实
good
在整个的溯源过程当中
relationship.
是一个科学的问题嘛。
So this is a scientific matter,
都是比
and scientists
求真的
always communicate with each other in a common pursuit of truth.
我是回答你的第一个问题。
So this is to answer your first question.
血液
Second, on blood samples,
还是非常好的。
I think this is a very good
其
question.
实溯源的一个问题，除了早期的病例的流行病学追溯以外，
Apart from the epidemiological investigation for early cases, if we can have testing for early blood samples then it would be helpful for us to find out the early appearance of the virus. According to the report, the earliest case happened on the 8th of December, but that does not mean it was the actual first patient to be infected, which means regarding how the virus jumped from animals to humans, or the patient 0. Who is that patient? The December 8th case in Wuhan was not believed to be patient 0, and there could be even earlier cases. But where are they? Or where were they? So the region that reported infection the first may not be the region where the virus jumped from animals to humans, and that needed further studies. If we can test the blood samples, it would be the best. When we were in Wuhan, we made this proposal, and we asked experts from Wuhan Institute of Blood, the Wuhan Blood Center. The experts told us that they had the blood samples, but the samples were only used to settle the possible medical or even legal dispute. So it was only contained in a tube with a very small volume. According to Article 31 of the Blood Station Management Regulation, such samples can be stored for 2 years in terms of whole blood or blood components use. So it can be stored after the use of whole blood or blood components for 2 years. So this kind of blood sample can only be used to address legal disputes. Let me give you an example. You used a blood donated for a patient, and the patient got infected with some other diseases like AIDS, and the blood sample can be used to address the legal dispute. So it has a very small volume of serum. I recall that for a whole afternoon in Wuhan, we discussed this matter with the experts in the Wuhan Blood Center. It was mentioned in the report too. And we also talked about that after 2 years of use of those blood samples, we would be able to conduct the relevant research. The Chinese side has been organizing experts and organizations to get prepared for such work, and we are now formulating the methods and implementation plans for the blood testing. When the blood samples can be tested after the storage period, we would implement the relevant testing. And if we have any outcomes, they will be informed to Chinese and foreign experts. So this is for your second question.
Next question, please. Thank you. With China Daily, in February this year, the WHO expert team said that it was most likely that the virus spilled from animals to humans through an intermediate host, and the other possible pathway was introduction through refrigerated or frozen foods. What was your view on this pathway? Well, the introduction through cold chain is a new phenomena. I am an expert in respiratory disease. Infectious pathways for respiratory diseases, including cold chain introduction, deserve our attention. First, on epidemiology, when we found the relations between cold chain introduction and respiratory diseases, in tracing of epidemiological source, we traced the virus on the surface of the refrigerated or frozen foods, for example, in Xinfadi market. The infected person had contact with the refrigerated foods with the virus. And second, on the virus tracing, nucleic acid result was positive, in particular in the outbreak in Qingdao. Nucleic acid was tested and virus was separated and tested. So the refrigerated and frozen foods contained the virus. So combining these 2 points, the evidence is quite clear. And we also have found out that when the environment is dry and cold, the virus lives longer and is more infectious, like 21 days in cold days. If the virus got on the frozen or refrigerated foods, the environment is relatively cold, and then the virus is transmitted across different places via the cold chain. So this is a new phenomena that was studied, and the evidence chain is quite complete. So this phenomena deserves our high attention. And in the origin study, we strongly recommend that cold chain be considered as a top priority in the origin studies, especially given the international trade, and it has added to the complexities of transmission. So it's worth study. Next question. Thank you. From Xinhua News Agency. Since the start of COVID-19, research has played an important role. What has the Ministry of Science and Technology done in the origin study? Well, let me answer your question. Thank you. Well, today I feel that the house is full and many of you listened attentively with a serious attitude. And this shows that many of you have come to realize that origin study is a serious matter. In essence, it is a science matter. Science research plays a significant role in origin study. The Chinese government takes very seriously origin studies. Since the start of COVID-19, we identified 5 major directions of research. and origin study is one of the 5 priorities. Now, the Chinese government made it quite clear that the science community needs to make every effort and uphold the attitude of openness, transparency, and responsibility to answer well the major question of where the virus came from. And for that to happen, the Ministry of Science and Technology has organized research teams to conduct joint research and studies with priorities on animal, humans, molecules, and environment. And we conducted our work in a science-based way. Let me give you an example. When we identified human-to-human transmission, the question is, will it be transmitted from human to animal? Where did the virus came from? Was it animal-to-human transmission? That was the matter of origin tracing regarding animals. We organized experts nationwide and conducted studies on wildlife and domesticated animals across China. We conducted virus tests involving 40 to 50 animals, including pigs, oxes, sheep, chicken, duck, goose, pigeon, turkey, hare, and boar. Altogether, 80,000 samples. No positive result for antibody or nucleic acid tests. And on that basis, tests were taken in laboratories in different categories so that we can get a clearer picture and get a clear direction of our tests going forward. And second, to identify the source of the virus, bats have become the center of attention, and research teams conducted tests, especially on the similarities or homology of genetic sequence. ITG13 has the highest homology with 96.2%. And with further studies, we found out that the RBD homology is only 89.3% with amino acid homology. And further tests show that ITG13, compared with coronavirus, it has drastic difference in terms of infectious capabilities. So the conclusion is that the evolution relations is quite distant, 50 to 80 years, as researcher Yuan just talked about. It was quite distant. Apart from bats, researchers also conducted tests on other animals that might carry coronavirus related to SARS-CoV-2. For example, scientists tested multiple strands of coronaviruses in the pangolin smuggled and intercepted by the customs. The genome homology is as high as 92.4%. In one strain, amino acid homology is high as 96.9%, higher than ITG13. So based on these tests and research, scientists believe that it is likely that coronavirus on pangolin might play a role in the evolution of coronavirus. In the molecular origin tracing and other directions, Chinese scientists have also done tests and research. As of July 19th, together with the United States and the UK and other countries, they have published over 225 articles, and Chinese teams published research articles altogether 352. And Chinese and American medical and research experts have had 6 video conferences on COVID response. We have actively carried out data and information sharing on science research. And based on the China Bioinfo Center, we established a coronavirus info database shared with the world. And altogether, 2.53 million genome sequences have been uploaded and shared. Origin study is a difficult science matter. There are many uncertainties. It remains a heavy task. And we need to recognize that origin study is a highly important work. We must answer the major question where the virus came from. Despite the difficulties and odds, we must uphold the attitude of science, the methods of science, and facts of science to conduct science-based method origin studies. Can we reveal the truth?
Thank you. With CGTN, recently there have been reports that Chinese research have deleted the genetic sequencing of early cases uploaded to NCBI. What is your comment on that? Well, let me take this question. Well, after this issue was reported, we have learned about what happened, and let me share some information with you.
On this matter, some researchers in Chinese universities issued an article in international journal, SMALL, SMALL. The title of the article is Nanopore Targeted Sequencing for Accurate and Comprehensive Detection of SARS-CoV-2 and Other Respiratory Viruses. So you can tell from the title of the article, it is about the method of sequencing test. In March, when they sent the article to the magazine, the editor asked them to provide sequencing results to judge whether the method is accurate and reliable. The researchers were required to provide the results, and hence the researchers uploaded the results to the NCBI database, the National Center of Bioinformation, management by National Institute of Health of the United States. And on June the 9th, the magazine sent the copy of the article about to be published to the researchers. It was at that time that researchers found out that the previous content in the original article about the data results of virus sequencing was deleted in the editing process. That was why the researchers believed that there was no need to put related data in the NCBI database. On June 16th, the researchers sent an email to NIH for a request to retract the data. And in accordance with their working methods, automatically the data was deleted by NIH without notification to researchers, and the researchers also ignored the matter. So you can tell from this process that there's no such thing as the researchers hide or cover up anything. And recently, the researchers uploaded all the 244 sequencing data to the GSA database managed by China National Center of Bioinformation. The database is open. Researchers around the world can have access to it. According to our knowledge, the earliest sample time was January 30th, some time after the start of COVID-19. They were not early-stage samples, and the information and value they can provide is limited. Jesse Bloom, an American researcher from Hutchinson Cancer Center, without prior confirmation notification of Chinese researchers and without any knowledge of what actually happened, fabricated a conspiracy theory about the Chinese researchers cover up certain data. It has created a negative image in international publicity against Chinese researchers and China. Such actions violate science spirit and the law. Such a conspiracy theory has been criticized by experts in other countries. It is unscientific. With COVID-19 still raging, people follow closely what the scientists do and what the scientists say. Each and every scientist and expert must be fully aware of their social responsibilities. In particular, words and deeds on COVID-19 are always followed extremely closely by the general public. All the scientists must do their best to contribute to COVID response as a professional worker and to make comment based on science. Instead of inventing stories, it would cause negative impact and distort science. We hope that lessons will be learned. Scientists are not just scientific experts. They also show the social responsibilities they need to fulfill such responsibilities. Thank you.
Last question. Thank you with Global Times. The coronavirus, the starting point of the spread of the coronavirus has been put forward again and again. Some are calling for researchers in some other countries, including the United States. What is your comment? Well, let me take your question and I'll see if other colleagues have anything to add. As scientists are continuing with their studies in various countries, many outcomes have come to prove that the starting point of the outbreak of the coronavirus could be earlier than the timeline that we currently know. I can share with you some examples. In November 2019, An Italian woman's skin biopsy revealed multiple SARS-CoV-2 in situ hybridization reactivity. In November 2019, in a wastewater sample, the genetic material of the novel coronavirus was detected in Brazil. In December 2019, in 9 states in the US, SARS-CoV-2 antibody was tested in 106 samples. In December 2019, samples from Iran, Brazil, and Italy were uploaded to the global database in terms of the genetic sequences. In December 2019, there were reports in France that the prevalence of neutralizing antibodies was increasing. On the 27th of December 2019, the RT-PCR testing for SARS-CoV-2 of a throat swab from a patient in France was positive. In January 2020, in a wastewater sample in Barcelona, Spain, it was tested positive for SARS-CoV-2. From January to March 2020, in over 24,000 blood samples from 50 states in the US, 9 samples were tested positive for SARS-CoV-2 antibody. So these are the examples of the research outcomes of many scientists. So it shows that Wuhan might not be the first place for the outbreak of COVID-19. The virus was spreading from animal to human, and from objects to human, and then from human to objects. So it has been a repeated model. And new evidences are providing new perspectives for us in the research, and those are scientific issues that need to be addressed. How did the virus jump from animal to human? How did it transfer from objects to human and then from human back to objects? So there are new perspectives for our research. As we go forward, for early cases, biological samples, genetic sequences, natural hosts, intermediary hosts, or cold chain, all these subjects require joint research in multiple countries and multiple places in the world. We need to learn about the global spread of the virus, and to do that, we need to have a more in-depth understanding of the diversity and the evolution of the virus in animal hosts, as well as the interaction among animals, the environment, and humans. So those are what we need to further study in the future. And plus, the virus is a common enemy of humanity. Whether to prevent or to treat the disease, it calls for solidarity. On the important and complex challenge of origin tracing, it also necessitates the cooperation of scientists from all over the world, as well as the cooperation of the general public. Thank you. Well, let me share with you my observation. That is, there has been international scientific discoveries that prompt more possibilities. It is a very complex and diversified issue. So we need not confine our horizon to a single place. That is to say, we need to carry out multi-country, multi-place origin tracing study worldwide. Well, if there's nothing to add, let me thank all of you for coming to this press briefing. Thank you.